Same thing with pelvic floor. We're going to exacerbate some symptoms because we have to push into it and strengthen into it. There's no other way.
There's no other way.
No other way.
You heard it today, Dr. Shayna Temple. There's no other way.
There's no other way.
It's just like Kegels. She said it. They're not 100% for everybody. So if somebody told you to go do Kegel exercises, that is not always the right thing to do. It might help and it might not.
Welcome to Athlete's Edge with Doc Dolly.
Smith grabs the puck and scores!
Providing athletes with a scientific edge in achieving goals and optimizing performance. We bring in expert healthcare practitioners and high-performing athletes to share case studies, cutting-edge research, and their invaluable knowledge.
Had him dead to rights. McDonough cross. They score! Nikita Kucherov!
Whether you're looking to enhance your training, prevent injuries, or reach new heights in your sport, you're in the right place. Let's introduce your host, from Rhinelander, Wisconsin, former collegiate athlete and owner of Motivation Health and Wellness, Dr. Jason Dahlquist.
They score! It goes in!
Welcome back to another podcast, guys. I am Dr. Jason, and we are here with my bestie, Dr. Shayna Temple, from school. So she went to DPT school with me, University of Findlay in Ohio. We're not going to get into the school because we both are branching out from the traditional views, the traditional physical therapy where you go to school, they teach you how to work for people, and then that's what you do. So Dr. Shayna is a pelvic floor therapist, and she is starting her own business, just like what I have here, out of network, really get to take care of people how we see fit and how you guys deserve it. And just for the athletic population, it is very underutilized and under-talked with pelvic floor because it is a very personal area, and that's what we're going to do today. So Dr. Shayna, introduce yourself here. Tell us where you're at with your business, and then a little bit about pelvic floor.
Yeah, so as you said, my name's Shayna Temple. I am based out of a rural area, and so as it serves, my business is Rural RX, and it serves active adults and athletes, and I also do the pelvic floor physical therapy. Not the only thing that I do, but definitely is a big need in my area. Currently, I still am serving in some of the bigger clinics, we'll call them the mill style, where we see patient after patient in no specific niche. And with my frustration in this area, I have also developed a side gig that I hope to make my full gig in this cash-based form, as Jason talked about.
Yeah, so we have a couple research articles that we're going to dive in today, and it's very interesting. Shayna picked these out, so she's going to do most of the talking about them, but they're very interesting. I read through them, mainly just the abstract because she's got all the details, but and all the background knowledge. So we're going to grill her a bunch of questions, but these two articles are very interesting because one is on education and one is on lifting heavy things. So I think just in general, when you know how to take care of yourself, it's not just the pelvic floor, because the pelvic floor is made up of muscles just like your biceps, shoulders, neck, whatever. So if you train them, naturally they perform better. So it's more of the how you can train them, but it's very interesting that you picked up just like, hey, the more you know, the better you are. And a very interesting research article about lifting heavier and how that translates to pelvic floor. So for athletes, active people, we're in the right place because we're going to talk about all of those goodies today. Well, do you have a preference which one you want to talk about first?
Let's start with the lifestyle, like the educational one.
I'm going to read through the objective of the research article here, and then I'll let you kind of branch out and talk a little bit more about it. Sound good? So
Yep.
This article, I can't even say the person's name, but it's the importance of pelvic floor lifestyle program in women with pelvic floor dysfunctions. And granted, this is a pilot study, so it's kind of like you're diving into a new area of research, but they have some really good findings from this study, which lays the groundwork for future research. Very good stuff. So here's their objective. We aim to assess the impact of an educational program on the symptoms and quality of life of patients undergoing supervised pelvic floor muscle training. Secondary objectives included baseline assessments of patients, knowledge of the pelvic floor, and patient satisfaction and symptom improvement after the entire pelvic floor muscle training program. So dive in a little bit more about this research article. There was 79 women that were included in it, so it's a pretty good population size. Granted, it's always nice to see thousands of people, but it again we're laying the foundation. So talk a little bit more about the research article here.
Yeah. So as you said, it is a pilot study, so it's first of many. But it's not alone. Like this study I picked because I liked its setup, but there's multiple studies saying the same thing, that pelvic floor education takes us a long way. And so there's a big trend of us calling it black box conversations. And you may have seen this on some of my social medias. So essentially, as we go through health education in high school, even as we've graduated with our doctorates now, like we didn't talk about the pelvic floor much. We skimmed right over it. We identified some pictures in a book, and then we moved on. So even as a doctorate of physical therapy, I didn't know much about the pelvic floor. And so that's a high level of education. So if we expand this upon the general population, in general, we know that like we don't know enough about the pelvic floor, not nearly enough, or really just about our bodies in general. And so I chose this article because it kind of talks about that. So as you said, 79 women went into this study. First, they went through 4 educational sessions talking to them about the pelvic floor, helping them understand what things are. This is no like hands-on feedback, no biofeedback or anything like that, just some education. And so essentially 73% of the people that participated, so that's 50 people out of the 68 that qualified to be included, felt that they felt much better or were doing better. And that was over just 4 sessions of learning. That's it. Knowing what's down there, knowing what its functions are, so on and so forth. After that, they went through a feedback session, and then they also did some personalized training. After like some of the other training, they did improve, but not as significantly as those 4 educational sessions. So what this suggests is that just by education alone, we can improve the symptoms and quality of life in the pelvic floor just by reinforcing some of these things. And these type of studies, these pilot studies, are going to go on and have more, obviously, bigger research and more technology involved that's way above my head, that will tell us even more about this and what different factors are more effective, less effective, etc. But this is pretty big in telling us that step 1's education.
Which is huge. So even when you are looking at, say, low back pain, when somebody understands what is going on with their low back, they tend to have less pain, less issues, because they know how to better deal with that. They really understand it. So there's a psychological piece there as well. With the people that you've worked with, when you talk to them about their pelvic floor complications, how much does the psychological factors carry over? And how do you kind of see this research correlate with that?
Yeah, absolutely. So the psychological aspect is massive. Like it's massive in all musculoskeletal care, but because this is such a quiet area, this is an underserved area, I'd say it's larger, but that's my own opinion. And primarily with fear and like misbelief. So tons of examples. whether it be like a high school athlete who's peeing during sport, like that's embarrassing. They're scared. What's going on? Is something wrong? Fast forward and maybe they've had a child. Well, now like they feel that they are weak. They are fearful that they're going to hurt something. And so there's a ton of psych things that we work through. And that doesn't even include, I don't generally work with like trauma patients. And there's a whole nother layer of psychological help that needs to take place there. So yeah, I don't know if I answered that question or not, but massive. And there are times that, okay, let's reduce the fear. Let's work through this. And then there's other times it's like, we need to bring somebody else on board, whether it be a psychologist or someone to kind of further assist.
Right. But really when it comes down to is understanding what the pelvic floor is and how to even activate it to help with issues, or understanding what the actual problem or dysfunction of the pelvic floor is. Because like in this other research article, which we'll talk about, but they talk about the pelvic organ prolapse. And some of these are, they're tricky. So like when they pop up, and you talked about it earlier about having a niche of pelvic floor therapy, which is what you're in, and not having the education in PT school, that's where I'm at, because that's not my specialty. So if somebody were to come to me, an athlete, they need to have the trust to be able to even bring up these issues. And I'll even ask, because it's part of our jobs, is to identify like, hey, when you lift, especially if there's low back pain, because it's all very located in the same area, there can be a lot of crossover. But if they have issues, I can help to identify those. But my education into it is like, okay, Dr. Shayna, I've got this patient. They have these symptoms. How do we address this? Or how can they work with you? That type of thing, because I'm not the specialist for that and I don't have the education. Not that I don't want to learn that, but I also know that that's not my specialty, and you can't know everything. You can't specialize in everything. And I don't want to be a generalized clinician. So this is important. This is really deep stuff that really understanding and being there with the right clinician can get you some serious results.
Yeah. And that's cool that you like identify that like you do ask about it, but then there may be a place of let me phone a friend or let me refer. Because I just feel there's so many in the grand scheme of things that are like, you're here for back pain. Let's talk about your back pain. And that's one thing that I never anticipated going and getting pelvic certified for that to improve my low back management. Well, whether it be I'm asking about periods and, the cycle of that, or is your pain cyclical? Do you feel that pressure down? Is that related with when your back pain flares up? Do you have a lot of tension down there? And so on and so forth. And you really start to identify more, especially in some of these female athletes, that's going on more than just back pain when you start asking the questions. But there's so many out there. There's great clinicians, don't get me wrong. Exceptional. But when we are generalists, we generally just do a screen.
Yep. Well, because you don't know more. And even if you do know the questions to ask, you don't know how to interpret the results. So it's nice to have somebody else that is specific for that. And that's why you have different branches of the healthcare system. But kind of walk us through a little bit more of the education, what that looks like when you see somebody.
Sure. Yeah. So I think when I get, I guess it depends on clientele. So let's just say like young, has not had any births yet, like no complications, but they're having issues. So bare minimum, like we are pulling up pictures or a model, whatever I have with me that day, and we're showing people what is there. I like to kind of use the example of like a biceps. So if I have no idea what my like elbow does, but my struggle is getting a drink to my mouth, Well, if I have no idea that my elbow bends, like that's going to be really hard. So like that's step one. Let's teach you that your elbow bends. Let's teach you that your pelvic floor lifts and relax. Like, so that's where we start. And depending on the assessment, you know, we may be working on relaxing things down, pulling things up. There's different scenarios for different moments in life, whether it's, you know, when are they having the issues? Is it when they're jumping? Well, then we're going to start talking about the anatomy of what needs to happen when you jump. Is it when you're sneezing or coughing or deadlifting? Well, we're going to talk through the anatomy of that and just first helping them understand. A second layer, after just structurally knowing what it is, we start to look at a lot of like easy fixes. So like environmental things. You know, are you drinking coffee all day, every day? Well, then you're probably peeing all day, every day. And you probably have high concentration of urine at that rate. And then there's a lot of nutrition that goes into it, but that's kind of the quick fix. Are you getting enough water? Are you doing the bare minimum things that we should do to take care of ourselves? And then upon that, we start really kind of doing a normal physical therapy evaluation of what's weak, what's stiff, what needs worked on, what are our body mechanics, and we kind of just go from there.
Yeah, the education goes further for somebody if they can learn how to take care of themselves, identify the problem, obviously, work towards a solution, but really understanding what's going on, why it got to that point, and how to move forward from there are huge for people. And unless you educate them, they don't get that. And then when you're done working with them, everything comes back. And that's why the education is so important. And it's funny too that you talk about the coffee intake and what people have, because that's all of a huge educational factor on why somebody may be having the urge to empty their bowels faster, and not even looking into like the athletic population, but even older. I was at Aspirus for clinical rotations, and I got to observe one of the pelvic floor therapists. This guy wasn't even in for pelvic floor specific therapy. He was in for an eval for like his hip or something like that. And then you get into your subjective history, your subjective assessments, and this guy has more pelvic floor issues than, you know, anybody else that pops up. So it turns into like a pelvic floor eval, because those problems that he didn't know were related, and they were more concerning than, you know, his anterior hip pain, which, yeah, there's a muscular involvement and general physical therapy exam that needed to be done there, but also you would have missed out on a ton of information. And one of the things that she talked to him about was essentially like training his pelvic floor, training his bladder so that he could sleep throughout the night. Or when he went to do those heavy activities, he didn't leak or, you know, wet himself. And those are huge factors.
Yeah.
And it's so cool because you have the male and the female side of things, and how often men talk about their pelvic floor issues. Not much.
Mm-mm.
I guarantee they try to hide that. Even for females, like nobody really wants to admit that they wet themselves.
Mm-mm. Not at all.
You know, like I don't.
Yeah.
You know,
even when, you know, they've gone through a massive surgery, whether it be male or female, or a major birth, like they still have like embarrassment around this normal thing to happen. And because of that, don't seek treatment and just deal with it. And it's something that needs talked about. So yeah, absolutely.
Yeah. So we're here. Anything else you want to add about education, or if we kind of jump over to more of lifting heavy things?
I think I would just add a caveat of like, be careful what you see on social media. You know, we've seen Kegels be a godsend, and we've seen Kegels be a absolute no. And so just with that, just being careful what you're seeing there, because both are incorrect. There's a time and a place for Kegels to take place. But other than that, I think the only other thing we haven't touched on like an education place would probably be like the fatigue of the pelvic floor.
Ooh, tell us
Especially,
more.
what's that?
Tell us more.
Tell us more. So we've touched on a lot about like strength, but that's another big component with especially athletes is not only do we need to be able to lift and squeeze tight to stop anything when we cough and sneeze, but if we are a runner or a jumper that does things for a long duration, like, well, we need to be training in those positions for that long duration and training up to it. So we're not going to try and squeeze up and in as hard and as fast as we can and expect that to take us through a mile run. And a lot of times that's what we'll see when we're working. We'll do the education. Quickly they get better. But when they run 1.35 miles every time, symptoms set in. And so it's just like any other muscle. Let's take it back to the biceps. If we've been lifting 3-pounders for 3 minutes, and that's where we're at, we wouldn't expect to go grab a 20-pounder and be able to do it for 6 minutes just jumping straight to. So the pelvic floor is just like any other muscle, and it needs trained in its strength, its power, and in its endurance. And endurance is missed a lot of the times.
Yeah, that's a good factor. When you talk about all of the different types of training, so you've got your different energy systems, muscle fibers correlate with those energy systems. So if you just train it to work really heavy or really fast for a very short period of time, you're going to have a different result, or a pelvic floor that acts differently than somebody who trains it, this way for more of an endurance-based activity. Right? Am I right on that?
Yeah. Yep.
Okay. So it follows along with the similar or pretty much the same physiological adaptations to exercise.
Yeah. Yep. And and the only difference is, when you squat heavy, like your legs feel tired, like that sensation. However, like when you do the same thing with training in pelvic floor, you feel pressure and you have more symptoms. And so that's a really hard sell, I guess. When we are doing some of these therapeutic interventions I guess it's the same as like when pain gets a little bit worse with tendon therapy. So we're rehabbing a tendon, it gets a little bit worse, but then gets better. That's usual. Same thing with pelvic floor. We're going to exacerbate some symptoms because we have to push into it and strengthen into it. There's no other way.
There's no other way.
No other way.
You heard it today, Dr. Shayna Temple. There's no other way.
There's no other way.
It's just like Kegels. She said it. They're not 100% for everybody. So if somebody told you to go do Kegel exercises, that is not always the right thing to do. It might help and it might not. So
very false. Yep.
Definitely something to know there. Very, very big education, because the Kegels are a very standard treatment that you're going to get from everybody in general healthcare.
Absolutely.
You want to take us through lifting heavy shit?
Let's do it. So I guess I'll start with, in the past, we've probably all heard, if you're pregnant, don't lift more than 20 pounds. It's really bad. And so we'll kind of start like there's where we're at in research. It's really bad is what we've been told. And tons of research has come out now saying that that's a load of junk. It's not true. And so I chose one article that kind of shows this a little bit in a larger scheme. So this is a collective survey on pelvic organ prolapse and what these people are doing in their lifestyle and some of their internal and external factors. So everybody in this study was 18 years of age or more, and they broke them up into 3 sections. So the first group was lifting roughly 30 pounds or less. Second group was lifting 32 to 100 pounds. And then the third group was lifting 100 plus pounds for exercise, and that's where they fit into the category. So this was close to 4,000 people that participated in this survey. So it's much bigger than the last one. And with these people in this survey, they were found that 14% of them, so they just asked them by random, 14% of these individuals that were asked did have pelvic organ prolapse symptoms. And this can be an array of symptoms. Most often, this is going to be pressure, heaviness, different things like that, different times in the day. So we're working with 14% of them, definitely positive. Categories, obviously, we already broke up the weight that was being lifted, age, vaginal parity, which is if they've had a child or not. They looked at constipation and hemorrhoids. They looked at family history of having pelvic organ prolapse or related symptoms. And so with this study, looking at all of that, they found that physically active women lifting weights less than 15 kilograms, so the 30-pound group, anything less than 30 pounds, were more likely to have reported symptoms of pelvic organ prolapse than the women that were lifting more than the 50 kilograms, so the 100 pounds, roughly 100 pounds or more. So there's been multiple of these studies that came out, and essentially they're saying that everything that's been being told to these women after birth or during birth, don't lift more than 20 pounds, has been putting them in this first category of being at a higher risk of having pelvic organ prolapse. So not only are we now having total body changes with pregnancy and totally shifting and having discomfort, and then we have a baby and oftentimes are not sent to physical therapy, and now we have a higher risk because we had a birth to have pelvic organ prolapse, and now on top of that we're being told not to lift heavier than 20 pounds, putting us at a higher risk of pelvic organ prolapse. So what we're doing here is just laying bricks on top of bricks for us to have pelvic symptoms. So like no brainer that everybody after they have a child is like, oh, I pee, it's normal. No, it's not. No, it's not.
No, it's not. It's not normal. And they have research out that supports going to physical therapy. Like the success rate's above like 75% for like reversing those symptoms.
Oh yeah. Yeah.
From what what is your take on that?
I don't have stats off the top of my head, but pelvic therapy.
But it's high.
And it is highly effective. Like conservative management is highly effective, and it's still not like the gold standard. You know, I love the example of like we have a knee scope where we take like these little tiny like robots and we go in and we scope the knee. Probably 2 months of therapy. Or a shoulder scope. Well, you'll be in a sling, so 6 months of therapy. But if you push a 10-pound baby or get a 10-pound baby cut out of you, go home and lay around for 6 weeks, return to work after that. No therapy.
It's a great example. It's stupid.
It is.
But it's like everything's ass backwards when it comes to what people see physical therapy. It's like if you go talk to the right person who studies the right area of what you need, you're probably going to avoid surgery at all costs and be better off by not going through surgery and faster. Much faster recovery time to take care of the actual problem, and they didn't cut you open with a bunch of tools.
Right. Yeah.
It's insane. It's all backwards.
Yeah. And so I feel like that's a big thing that we have on our side of business is how do I get you to understand that this is an investment service and it's going to be costly. Like you are investing in yourself, but look at all this that we are avoiding. Like how expensive is surgery? And then you're still going to have therapy after that. And then I don't know, maybe surgery goes well, maybe it doesn't, maybe you need another one. And so then ultimately, like, let's look at this first investment window.
Yeah. And that's literally what it is. And when you talk about a high ticket investment, our services really aren't much more than anything else that you go to get. So like chiropractor, $150 to $200 to see a chiropractor in a small rural area if they don't take insurance, and you're in there for 15 minutes. You go to the dentist, they clean my teeth, and the doctor looks at him, says, "Yep, you're good to go." $170. You know what I mean? And then to see a doctor of physical therapy to do what we specialize in could be anywhere from $150 to $300 for an hour of time that you spend with somebody and with the specialists, and you get a plan to work on, you get the education, you get everything to take home. There's so much value in that, but people don't understand that. They don't know that yet.
Yeah.
Because they're so used to, go to insurance, we'll see you for 30 to 45 minutes, and that's pretty much it. Go home, and if it doesn't work, then we'll go this route where the doctor already told you it wasn't going to work, so you came in knowing that it's not going to work. So we get that. We're able to educate people based off the research before they get the uneducated providers telling them that this is the route you need to go when it's not.
Yeah.
On my tangent there.
Right.
But anyways, yeah, there was almost 4,000 people in this last research study, the one that you just went through.
Yeah.
Those are big numbers. That's a lot of data there to support lifting heavy. And I was just talking to somebody else too, because the general rule of thumb is to not lift when you're pregnant either. At least, towards the later stages, where I've known quite a few females that have lifted heavy weights and are much better off because they maintain a healthier lifestyle because they're moving. Their body responds much better.
Yep.
And when you take research like this, the correlating factors are different because you're talking about women lifting heavy weight, not while they're pregnant, but you could still kind of factor in all of the other research to like females who do lift when they are pregnant. Like if your body is able to maintain a baby along with the strength through the pelvic floor while pregnant, you have less time off, so those muscles are going to adapt back to where they were much quicker.
Yeah. And that's something that kind of floats around like the pelvic space is like having a baby is hard. Being postpartum is really hard. Being postpartum and decondition is way harder. Like if you need to come back from not only a body change, but also because you stopped exercising for 9 months, like that's a huge mountain to overcome.
Huge.
Yeah. And so all of the research, 10 years back did tell us, don't lift more than 20 pounds. And that was because of one research study. One research study tested women pregnant to lift 20 pounds. They didn't test 50 pounds. They didn't test 100 pounds and say it was unsafe. They just tested 20 pounds and it was okay. And so from there, the standard set, don't lift more than 20. And so now that went out into all the healthcare facilities and they said, don't go higher than that because we don't know. And so what's so hard about like people lift pregnant? Yeah, you just mentioned, like we see it. It happens. Many people have fine deliveries with it. And research tells us in an uncomplicated pregnancy, that is fine. Now there are specific places like placenta prevo and different things like that, or maybe you're having issues with your own blood pressure management. Like, yeah, there's cases where let's pump the brakes. But for grand scheme of things, like it is safe. But what is hard is ethically, we can't go out and be like, hey, who's pregnant and wants to see if it's safe to lift 150 pounds? Like it wouldn't get approved and nobody right. wants to push the standard. And so the only thing that we're seeing is people doing it. We're not seeing research studies that we can stand on because it's not ethical to see if it's safe for a baby. But we're just seeing people do it. We're seeing professional athletes do it. We're seeing them jump in way sooner postpartum. And I don't know. We're in a cool time.
We are. Well, we're in a time of technology and social media, and you have people like us that are doctor professions, and you see them and their crazy CrossFit journey or their crazy running journey. Like I know somebody who ran while she was pregnant the Boston Marathon with the same baby twice, which is crazy to qualify 2 times for the Boston Marathon and run it twice with the same child pregnant. And there's a lot of people who can't do that not pregnant. And for somebody like that to take away their complete active lifestyle, and to do what the norms say to do,
Mm-hmm.
that's crazy. You're like
Yeah.
literally putting them into a path of depression.
Right. Yeah.
Like, here you go. You can't do anything that you were doing before, which is you live an active lifestyle. You are an active person. Do nothing. To take that away from somebody, oh, you're asking for other problems.
Yeah.
But even to see all of these other, influencers, doctors, and a lot of them are doctors of physical therapy too, and they're in lifting as much as they possibly can, puking in buckets because they've got morning sickness. Like I've seen it all across social media. And when they go and they share their results for like lab results and their physical fitness, where they're at through their pregnancy, it's all like standard of numbers, like even better than the standard of numbers. Like they're doing very, very well. And that is as much research as what any of these other research articles will bring out to show, because you have case study after case study. There's a lot of power in that of people being successful. It's just not in a strict model.
Right. Yeah. And we know like the healthier that we can be before pregnancy, the better off we are. We know that if I exercise, my cholesterol is better, my blood pressure is better, like my glucose tolerance is better managed.
Mm-hmm.
And so where I don't know where it got twisted in the line of, well, now that I'm pregnant, none of that applies. Now I just need to sit here.
We're coming across a lot of those examples.
Yeah,
Like just as we age, it's normal for your blood pressure to go up, and it's normal for your glucose levels to be elevated. It's like, well, maybe it's the new norm, but it's not normal to be elevated in all these measures. You should have the same standards throughout life. Granted, you might get to the edge of them or fluctuate in and out of them, but if you are off on all of these basic standard measurements, vital signs, there's something wrong. And that's what we need to re-educate into people, and we're finding that out about research all over the place. As it's now coming up, you're asking the right questions. People are responding differently to treatments than they were in the past. And from the physical therapy, the conservative realm, it's becoming more of a gold standard because we have a lot more research, and the technology, social media, all of that has helped, in my opinion. Sometimes you get bad information. You run into the bad people that post things without having the background knowledge. But that's where having experts like yourself tell us all of the right things to do is good.
We can
lead us down the right path
and get on all of our soapboxes.
That's right. But and it's a lot of fun talking about these things because a lot of it is polarizing. Because you have the opposite side of the spectrum that says, no, don't do that. That's bad for you. And to change somebody's mind from a patient perspective, from the old education coming from their medical doctor or their family care provider that they've been seeing forever with high, like they idolize them like way up here. And it's like, hey, we have a doctorate. They don't. Not to throw like rank around.
Right.
Some of the family practitioners, they don't have a doctorate degree. They haven't gone to school for 30 years. They've been out. Yeah, you have a lot of clinical knowledge, but you don't have the new research. We just went through school to learn all of that.
Yeah. Yeah. And
so it's hard. And I don't want to say, yeah, I know more than they do, because it's definitely not the case in a lot of areas, because we're all study different things. It's almost like, hey, no, you need to get multiple perspectives on it and see what is the best fit for you in your situation.
Yeah. And degree aside, like it matters what you do after you have that. Are you staying up to date, or are you just doing what kind of works and has been working? Like, are you just giving people old knowledge, or are you a practitioner that is continuing to like stay up to date and be in a fitness forward, newer style of thinking, it really matters on what you're doing with your practice. And you're right. Like if somebody has a status, they'll just hook, line, and sinker. That degenerative joint disease, that's what's crippling me right now. Like even though it says mild, I got to get it removed.
Yep.
Okay.
Yeah. And that's literally our reaction. It's like, seriously, you want to go through surgery, and they literally told you that it's because degenerative disc disease, and you want to get a surgical procedure when 50 to 80% of somebody your age also has degenerative disc disease and don't have pain. Like they have significant amount of research on that, and you are going to just, your doctor, the person you trust, said that, you have DJD, gotta go get that removed, go get it fixed.
And
no,
I'm all here for whatever works, right? So like if it's working, great, do your style. But I've seen too many fusions, then it doesn't work. It makes them less mobile. It makes them less able to exercise, less healthy. Mm-hmm. The list goes on and on. And so that's one, and I'm sure you're in the same place of that's why I'm going to stand on this pedestal and say, hey, let's stop cutting first. Let's conservative first.
Well, and that's like we talked about earlier, when you have us out of network providers that do have the education on all of these matters. Yes, that's where the general education comes into play, because when somebody comes to talk to me about necks, I can educate them about the practice, what they need to look out for when they go to surgery. But I get to educate them first a lot of the time, because they don't have to get a referral to come see me. So that I can talk to them and I can build that trust, and we can start treatment right away. And then it's like, you have all of what we just built together to stand on. Go get another opinion. And now it's another opinion. It's not a gold standard opinion from a medical doctor.
Yeah. That's what's so fun about, I feel like, physical therapy is like, at the end of the day, like I'll do everything to get you to trust me. But ultimately, like we get to prove it. Like we get to teach them, and we get to show them in-session changes and long-term changes. And so I think it's really hard to get somebody's full trust when they have 5 different healthcare providers and every single one is saying something different. But like physical therapy, I get to prove it. I get to absolutely prove that my thinking is going to help you, because we see those small changes as we see them week by week. We're not seeing them every 6 months and just seeing what happens. And
right. Which is huge. Big point.
Yeah.
The big point, because we get to work with people much more often, much more frequently. We see them, and then we see them at each visit for a lot longer period of time.
Yeah.
And that can always change too. We could even see them more.
Yeah. And don't get me wrong, like love every profession. We need them all. I'm just saying I like mine.
Well, and I will say that there is a place for all of them, and a lot of them are very good at what they do. It's just some share old research, and that can be very detrimental to somebody's life. Not just where they're at in whatever condition they have, but a surgery can be life-changing. There's people where nerves get cut, and then they have a palsy, muscles don't work, bowel and bladder control goes, whatever the case is. Yeah. It's happened before, they just don't talk about it.
Yeah, infections and all sorts.
People have too much faith in the medical profession when it comes to surgery. I will live with pain unless it's excruciating and I can't move anymore before I get like a surgery, like a joint replacement or whatever the case is. It's just something that people jump into, and I'm like, you realize what you're doing? Like somebody's cutting you open.
That's kind of our world. Like, what's the quick
crazy
fix? How can I take a pill and make this go away? How can I have a surgery and make it go away? It doesn't sound very fun to do 6 months of therapy. Let's do something else.
Well, you're gonna get 6 months of therapy after, so might as well just do 6 months of therapy now and not get cut.
That's true. Yep.
But it's a big mental shift. Like, I just had surgery. It's almost like people put surgery as like a metal.
Yeah.
Like some people collect surgical joints, like they've got metal bionicle parts, and they've got like 6 of them. Got this knee, that ankle, that knee. I got here. I got this hip, this hip. I'm getting this shoulder and that shoulder. And
Yeah.
maybe the year after, I'm like, what's your goal? To have every body part fake?
Yeah.
I'm like, jeez.
Yeah, and almost as this person is in this healthcare system going cycle after cycle, surgery after surgery, the language is that shoulder is bad, that knee is bad. Like, and
Yes.
so we're not only in chronic pain, but now we chronically are thinking that we are bad and negative, and so it will be so hard to recover them back after. There's so many people that come in, oh, bad back, bad. Like, how is it? Why is it bad? How did it get bad? What is bad about it?
Yeah.
But just in general, people say it is bad.
Yep. And you can't fix bad. Can't fix bad.
Yeah. And that's what's so hard. Like, all these people are in on this mindset and this conversation, and like what we say matters. And so if we have all this bad and negative, it is so hard, like in an evaluation, to be like, nothing's bad. This is tight. This hasn't lifted a weight in 5 years. And nothing is bad. Let's make it better.
Yeah. It's so frustrating. It probably carries over to pelvic floor. What do they have for pelvic floor imaging? What do they do with that anyways?
Great question. So just like how we see back MRIs and how the prevalence of, we're going to find things. If you're 30 to 40, you're going to find things. So prolapse is the same thing. Many people have prolapse with no symptoms. Many people have symptoms and no prolapse. Many people have both. Many people have neither. So there's kind of those 4 different categories, just like with low back pain. And same thing, like many times, just because there is prolapse doesn't mean that's causing your symptoms. It's the exact same as low back pain. And so sometimes, they'll get into docs and I think it's a little better. They're not quick to jump into surgery in pelvic area as much as low back pain. Low back pain's like taking a piece of candy. Like, it is, there's so many back surgeries throughout the year. It's a little bit better in the pelvic area, but same thing. Sometimes we're fixing the prolapse area and, oh, that wasn't what was causing my symptoms. Or now we have more symptoms. Now we have more pain. Now we can't be aroused and have intercourse like we want, and, or an infection and so on and so forth. So the low back pain imaging and prolapse imaging, they're best buddies.
What exactly is a pelvic organ prolapse? Because I know you touched on it a little bit when we went over the article.
Yeah.
It's like the sensation of a bulge or something along with that, but what makes that sensation?
Yeah, so we have the vaginal wall, and then around that we have the bladder in the front, and we have the rectum in the back. And so we can have essentially a thinning of the vaginal wall in any of those areas. And so then the organs will put pressure on that area. So a lot of people think like, oh, and then of course uterus from the other side. People think that like it's going to fall out. Well, no, not really. We have more symptoms and sensation than how bad it actually is. So if we think about having a prolapse on the front side, like that's from the bladder, and all it is that the bladder has now pushed into the vaginal wall a little bit. And so now we have less space and we feel pressure and it feels heavy because it's not like what it used to be when we were 16 years old and a fresh pup.
And then lifting heavy weights essentially builds that wall back up, and then symptoms go away?
Not necessarily that wall. So the wall is more like a smooth muscle. So it's more like more like an intestinal lining. It's more of a line than anything, a soft tissue structure. But what we can do with improving symptoms is make everything else stronger, have more support from the bottom, from the pelvic floor, so we feel supported. maybe increase some range of motion on some, increase or like work on like trigger point areas, different things like that, depending on the assessment, and symptoms go away. So just like, let's say there's a back bulge, a disc bulge, we're not going to make that go away. Same thing, we're not going to make a pelvic organ prolapse go away. We're going to make the symptoms go away.
That's a good example.
Thank you.
I think everybody really understands what goes on at the back,
right?
Even if they haven't had, it's so frequently talked about. So yeah, I think that's a great example.
Yeah,
it helps me visualize it, anyways.
Yep, absolutely.
It definitely makes, because there's dry needling techniques where you can get way down in different areas in the pelvic floor that you can't reach with your hands, and it's another certification which I probably will never get into. Maybe for an educational thing I might do it. But yeah, it could be a very beneficial treatment. Are you certified in? I know you're certified in dry needling, but not the pelvic floor yet.
Yeah, no, I have not done pelvic floor yet. I've looked into some courses. I just haven't found it. I haven't found it necessary yet. If I find that I have clients where I'm like, they would really benefit from this, I would absolutely go get certified. But I've found that if we can hit glutes, like let's say it is a very tight pelvic floor, if we can hit glutes, if we can hit adductors, we can, and do some other pieces of soft tissue and stretching, that clears up what we need. So no, I am not certified, but maybe.
Well, and if you have the tools, interventions in the tool belt to take care of symptoms, that's the goal anyways.
Yeah.
You don't need it.
Yeah. But
right.
Right. But also, that in courses, if you take the course, you are going to have that on you. And that's a big commitment for me. I don't know. Needles down there might be a line.
I think you'd be fine.
I'll keep thinking about it though.
Well, but they do the dry needling. Have you done craniofacial?
I've done a little bit of face. Mainly
did you get
TMJ treatment? Did
you get your lateral pterygoid hit?
I did not.
Say they couldn't hit me, and I'm like, thank God. they couldn't get inside the little arch there in the is it the mandible? Yeah, the mandible is this one. So there's a little arch there in the mandible, and it's a very, very small opening, so you have to get it like perfect, and then it's just straight in with a 60 to 75 millimeter needle, and you go all the way down. You hit the sphenoid bone inside the face. But I got the one guy, he's like, get this out of me. He's like, get this out of me. I'm like, sure.
Yeah, I bet that's not a nice one.
But when he did, well, it's nothing that you can hit any other way. You can get to a little part of it if you go back through the mouth, but
yeah,
it's the same concept down in the pelvic floor. There's areas that you're just not going to stick your fingers on a patient.
Yeah.
Or you can't get to really get the trigger point release or the effects that you want.
Yeah.
Because you get a ton of physiological effects by inserting a needle into a problematic area, restarting the inflammatory process, which elicits everything that the body needs for healing an area. And it's just the list goes on, and there's also the effects of essentially cortisone without injecting a synthetic substance to the area as well. So there are a lot of tools that I think would be very beneficial, and I'd be super curious on how they do all of that around the pelvic floor, because it's a very guarded area for everybody, just like what your reaction was.
Mm-hmm.
You're like, I don't know about that.
Yeah.
But, imagine somebody who has those issues that need that extra little step. Yeah. And if you don't know how it feels and you're not comfortable with it, how are they going to feel with you doing the treatment on them? Right. But you're not going to do it unless you take the class anyways. But,
right.
It's just one more thing in the tool belt. Plus, when you go to the courses, like what you talked about, you also get the recent research on why you're doing the needling in that area and why it's important. And I just think that is worth it, whether you do it or not.
Yeah.
I don't know, just my perspective on things, because I might even do it. That's the whole spiel anyways, just because it's super interesting.
Yeah.
And I love learning about different areas of the body that I don't necessarily treat every day. Just because, you can only stare at the same exact stuff over and over and over again. And you pick up those little things, those little gems that you can hold on to for when you do have the pelvic floor patient that comes through. And then, I do have an option to help treat that, along with, hey, I'm going to pick Dr. Temple's brain on this to figure out exactly how we go about the other aspects of treatment. Kegel, no Kegel, those types of things in a home exercise program. And then you have a well-rounded patient outcome. But that just comes back to the networks that you build too, which is so great. All right, let's tie this baby up. Give us some of your final thoughts. The big things that we really hit on was education and increasing the strength through lifting, exercises. So kind of tie us up. Give us your 2 cents on the general scheme of what we talked about here with pelvic floor today. What do people need to know?
Yeah. I think that in general, just to keep in mind, like a strong body is a strong pelvic floor. Like they're one of the same. So let's get strong for one. Number two, we've really hammered away education. And so let's get educated. I don't care how you do it, whether you reach out to a physical therapist or a different healthcare provider or seek valid, let's throw that in there. It's probably not going to be from any social media account. Seek valid information. And then when we are going to healthcare providers, let's ask questions. If they can't answer your questions, then they don't have enough content and know-how in that area. But never is there a place where we're not allowed to ask questions because they are a doctor of whatever. Ask your questions. And if they can explain it in a way that makes sense to you, maybe they don't know enough. So ask more questions.
Yeah, that's big. No matter where you're at or who you're talking to, if they don't know and they're not willing to get you that answer and get back to you, then seek out other opinions and potentially just another provider in general, because if your provider's not going to take those extra steps for you, that just tells me that they're overworked or they're just not that invested. And when it comes to pelvic floor, it's a very, very important area. So unless you want to be the person wearing diapers when you do physical activity, like seek the right person, so and get the right education. Completely agree. Where can people find you? How do they get in touch with you to talk to you about more?
Yeah. You can reach out on Instagram, Facebook, fine with email as well. And I think Jason has my email that he's going, or all of my content to link.
Yep. I will put it down all in the show notes.
Perfect.
But is it just Shayna Temple on Instagram and Facebook?
Yeah. So I think it's Shayna Temple DPT.
Shayna Temple, Doctor of Physical Therapy.
No, it's Shayna Temple PT.
PT, just physical therapist. She's going based on the license.
There.
Yeah. Okay. And then your website will also be linked down below as well. So awesome. Check out those resources. Reach out, follow Shayna. She's got good content that she posts about a lot of everything. So get in, get some workouts with her too. And we will catch you guys next time.